Welcome, welcome, welcome. We're going live in just 1 minute. I'd like to welcome you to 10 minutes of tipping with the doctor. I am your host, Dr. Jacqueline Brooks, coming to you live from Charlotte, North Carolina. And now it is 6 o'clock, so we can begin. As I stated, I'm coming to you from Charlotte, North Carolina, and I usually tell you how the weather is. It is a little sunny today. However, it's a chilly day. Woke up today, it was in the 40s. So, like I said, some days is warm, some days is not so warm. Today is a not so warm day. Okay, but hopefully we will warm up a little more by the time we reach the weekend. Okay, so I like to first of all thank you for joining me today with 10 minutes of tipping with the doctor. And today our topic on this Wellness Wednesday is how to get the most out of your virtual medical appointments. And I thought it would be great. I know we talked last Wednesday about diabetes, and I may even talk a little more if we have time at the end of our session today about diabetes again. And thank you, Greg, for joining. But I thought about it when I saw this article, and I say so many of us now, because of the pandemic that's going on, our doctor offices are closed, or you don't really know what to do if you are sick and it's not something that has to do with COVID-19. Okay? So the first thing you need to do is, thank you for joining, Michelle. The first thing you need to do is make sure that you have a primary care doctor. Okay? If you do not have a primary care doctor, it's important to get one because, like I said, a lot of the doctor's offices are closed now, and they're only seeing people when it's an emergency of some sort. So if you have a doctor, you can call your doctor and tell your doctor the symptoms. They say, first of all, you need to keep good records. If you're having a fever, if you're not having a fever, if there are chest pains or different symptoms that are going on, especially if they're not related to a COVID-19, you still want to see a doctor, even if it's virtually, okay? Because there are other issues that can be going on at hand. You could be having a heart attack. There could be someone the other day was telling me some of their symptoms, and it was sounding like appendix. An appendix was getting ready to rupture. So you really cannot just say, okay, the hospitals are full, the doctors aren't seeing anyone, I can't go to the hospital, and just say, let me stay home and bear it. You still need to get medical attention. However, you just may not be going directly to the doctor. So these are some important things to remember, okay? Emergencies are still emergencies. Don't rule it out because it's not the fever and the coughing that it may, or something that you think that might be related to COVID-19. You are still important and your health is still important, all right? If you have any sudden chest pains or weakness in the side of your face or body, or sudden thunderclap, headache, those are all red alert symptoms that could signal that you are having a heart attack. That's why, or a stroke. So that's why it's truly important for you to write down the symptoms of everything that's happening to you, as well as how often it is happening. Example, if you were having a sharp pain at 10 o'clock this morning, when was the next time you had that sharp pain? Was it 10 minutes later? You need to document that and keep a dialogue of what's going on so that you may be able to share this with the doctor. And thank you, Gilbert, so much for joining also. And Denise, these things are very, very important for your health. And right now, if you look, everyone is concerned about COVID-19. So you might think, well, what am I supposed to do? I have a cousin that told me the other day that she was not getting enough oxygen. And you need oxygen to breathe. She has an oxygen machine and it still was not producing enough oxygen. So she did call her doctor and they did did it over the telephone or what have you, but they still had to send her to an emergency room, but they told her which hospital to go to and which hospital to not go to, because the hospital that is dealing with all of the COVID patients, they did not want to send her there because, first of all, her resistance is compromised because she has all of the illnesses already, and they did not want to put her in an environment where she would be more susceptible to getting COVID-19. So she was sent to another hospital, and she went there and they were able to care for her. But she told me that her oxygen level still did not get to where it needed to be, but she made the choice to leave the hospital and go back home to try to get better because so much is going on in the hospitals. That could be the doctor agreed with her, so then that was fine. But at least she took the step and she stepped out and she contacted her doctor virtually first. And that's what I'm saying. Don't forget that you have to use your virtual doctor at this time. Even when you make an appointment, there may be a follow-up. You may call and may not be able to reach the doctor at that particular time. They will set up an appointment with you. Make sure you have your telephone near you during the time that you are expecting them to call you. If you say, I'm going to have an appointment with them at 4 o'clock today, okay, at 4 o'clock, 3:30, 3:45, have that telephone near you. And remember that it may come from a number that you do not know. Also, you have to, if you have some blockage on your telephone or something that you do not answer unknown numbers, you may have to take that off because they may call you from a number that you may not be able to identify. So these are certain things that are important for your health during this particular time, especially when we see that there is so much going on going on in the hospitals related to COVID-19. You are still important. Your health is still important. If it's your leg, if it's your knee, it does not matter. You have to get help for yourself. And it's important to know that because I think I've talked to some people that have gone through some other illnesses while they're at home, and usually they would call the doctor about it. However, because of what's going on, they are staying home and just dealing with it. But no, you don't just stay home and deal with it. Please contact your doctor, your physician, and if you do not have one assigned to you, please go ahead and register with a physician, especially during this particular time, because you don't know what's going to happen, and you can't just say, I'll just stay home and it'll pass, because as I stated, it could be something very serious going on with you. Some people are suffering with pneumonia, but not necessarily COVID-19, okay? So even the chest pains that you might have, any of the symptoms, make sure that you are writing them down. You are addressing these issues with your physician when you have your virtual appointment visit with them, and be ready to share. All right. Make sure you're in a quiet place in your home and don't play phone tag. You know, they called me. Oh, I got to call them back. Oh, let me call them. I missed the call. Let me call them back. So if it's just like, if you know that you have an appointment, take that same, take it just as if you were going to an appointment. And just make sure, don't accept other calls at this time because you don't want to miss that particular call from your doctor. All right. You use health tech and equipment to your advantage. If you are supposed to have a ventilator near you or something else, your blood pressure monitor, because the doctor may ask you, what is your blood pressure right now? If you have a monitor at home, have that with you by the phone so you can take your blood pressure. Have a thermometer near you. So if they ask, what is your temperature right now? You can take your temperature. I know we are used to others doing these things for us, but because of what's going on right now, we may have to play nurse for ourselves as well as advocate for ourselves, okay? So if you have these tools in your home, make sure that you have it. And if you're diabetic, make sure you have your glucometer near you, that you can take it and say what your blood sugar is at this time. You know, it may have been a certain number earlier that day, but you make sure that you jotted that down, what it was earlier that day also. And when looking at it, when you're doing your virtual visit with your physician, make sure you have those items with you so you can test yourself and give the results. They may tell you to go to the hospital, they may tell you to go to the emergency room, or they may tell you something else. But if it's best to be prepared, and it's best to take care of yourself, because we don't want ourselves to say, because the hospital is full of people with COVID-19, I don't want to get it, so I'm not going to go there. As I stated before, they sent my cousin to a different hospital. And I'm glad to hear, Della, that your nephew is recovering from COVID-19. Recovering is the key word. And we can recover from most of our illnesses if we take precaution, we do the things that we should do, and still, as I stated, contact your physician. And now the 10 minutes have ended. And I thank you all for joining for 10 minutes of Tipping with the Doctor. Join us again on Friday, where we will have Fun Frugal Friday and learn how to stretch a dollar. Now remember, what you do today creates your yesterday, today, and tomorrow. Choose wisely, and thanks for watching. Bye.